Hi, I'm Dr. Salim and I'm going to talk to you about the process in which we carry out the assessments for ADHD. Normally what happens is we expect the patient to fill a few forms, mainly three forms. One is the ASRS scale, which is more of a tick box exercise, takes no more than 6 or 7 minutes to complete it. The second one is known as the self-report questionnaire, which is something that you describe about your difficulties. It is a questionnaire where you give examples both from your childhood as well as adulthood about the difficulties that you've had in terms of your ADHD symptoms. So this has to be descriptive, so you have to write examples from both the past as well as the present. There are about 18 questions, 9 of which are about inattentive symptoms and the other 9 are about hyperactive symptoms. You may have both of them or one group. It depends on each individual. And then the third form is the informant report questionnaire, which is also very similar to the self-report questionnaire, but in this case, you're not answering, but an informant is answering the questions, again in a descriptive style. The informant can be your mother, your father, a friend, a partner, husband, anyone who is well known to you, or rather you are known well to them. Once the forms are filled, we will carry out an hour-long assessment. That will be through remote assessment, or sometimes we see you face-to-face, and at the end of this assessment there'll be a diagnosis that is made. Perhaps I should explain a little bit about the 1-hour assessment. Here we take a complete history starting from your childhood right up until the present time. We also look for other comorbid conditions and do a risk assessment and make sure that you don't have any contraindications if we decide to prescribe you medication for your ADHD. So this is the process, and after you have been seen, a diagnostic formulation is made and shared with you, and if you happen to have the diagnosis of ADHD, then we discuss the treatment plan.